This is Alina Pierce from Bear River Health Department, and she is going to speak today on suicide prevention. Before we turn the time over to her, I just wanted to I've been asked to remind everybody, first to be sure and sign the roll. I started it in the back. Please keep moving it around. If you realize you haven't signed it before you left, let's find it and make sure you sign it. Yes, there is a sugar challenge going on, so be sure and grab all the muffins you can on your way out. And then the on-site health fair. I was asked to remind you of this. March 11th, 12th, and 13th. That's, Russ, remind me, is that Wednesday? Wednesday, Thursday, Friday? Okay, thanks. And I think all of you have signed up for, hopefully, the different screenings. The 11th is here from 8 to 12. The 12th is at the Sheriff's Office from 7 to 11, and Friday is at the Road Shed from 7 to 11. And the individual who improves the most from the 2015 Health Fair to the 2016 Health Fair will receive $100. Good luck.
Okay, well, thank you for allowing us to come. As Rebecca said, my name's Alina Pierce. I work for the Bear River Health Department as the Deputy Director for Health Promotion. And also Amanda Davis is here with us. She is the Suicide Prevention Program Manager. And so today we are here to give you some information, some tips, and some tools. And you will need some paperwork to participate. So we have those just sitting up on the chairs here. And I understand we're also having people view this by videotape, so we'll be giving instruction with that as well. If you have a hard time hearing me yell, I'm going to pass it off to her in just one sec, but yeah. Yeah, it's not a video, it's just for the video, so that's why. If you can't hear me in the back, you have to get my attention. I can yell pretty loud, so let me know. Or please move up because you will need some paperwork. So just before we get started with the presentation, what we would like you to do is refer to this yellow sheet that says QPR Gatekeeper Training Evaluation. We would love for you to complete that page, that first page, front page, if you would, please. You'll need that, and like I said, there's some up here on the chairs. And if you're watching this by videotape, if you would pause the videotape and go to pre-QPR and take that survey first, that would be very helpful for us. We're trying to gather information so that we can improve our presentation and also gather some data to continue to receive funding for our area.
Have we wrapped that up about that not test, evaluation? I don't know. Perfect. So to review our goals, today we're going to talk about something called QPR. Stands for Question, Persuade, Refer. We'll talk about that in a little bit and go through it, practice it, everything. But first we're going to talk about suicide locally, some statistics, some reasons why we're here. So question for you. If you're going to have a heart attack in a public place, and not in a front of emergency department, not in a hospital, but just a normal public place, in what city or what county do you think you should be in? It's kind of a trick question. We have the answer, but any guesses?
I didn't think we got to choose
I know, most people really don't, do they? The answer to this question is Seattle in King County. There are 1 in 4 adults are trained in CPR. So you have a much higher likelihood of having somebody there that is able to assist you until the EMTs and whatever arrive. That's kind of our goal with QPR. So QPR is similar to CPR. You're not going to be a mental health professional after this 1-hour training. That would be incredible. Just like when you do CPR training, you're not all of a sudden a heart surgeon, right? You are just somebody there, an intermediary that's trying to sustain the life until a professional can get to them. Same thing with QPR. So we are not mental health professionals. We're not there to treat this person, but we are there to be an intermediary to help keep them alive until they can get to a professional who can help them. And we understand that actually, where is it? Davis County? Weber County is actually adopting Seattle, King County's model, and so they are having much quicker response time, much lower death with cardiac events. But kind of an interesting fact, really close to home. So, why do we want to have QPR here for you guys? Why are you a target population for us to come in and do a QPR presentation? So really the focus of our presentation is to provide assistance to family members, coworkers, just friends of people who may be at risk for suicide, so that they have kind of an understanding of what they can do. We all have friends, we all have family, we all have coworkers. Obviously, you're all here together. It's hard, to expect psychiatrists or doctors to catch every single time that somebody is having a depressive episode or a crisis. And so we're trying to, strategically place individuals in our community to be those gatekeepers, to be individuals out there that are ready to help and ready to recognize possible suicides. Also, for you guys specifically, studies show that our police force, our trauma workers, people who are out in the community doing service on a daily basis, they have a higher rate of suicide. It's just the data, that's how it is. Having you strategically placed to either watch out for the community members you're serving or to watch out for each other is very important. One death is too many. I think we all can agree on that. So we definitely want to help you to prevent this. So why now? At this time, we are receiving a lot of grant money, mainly because of those studies that I told you about. We're finding a lot more about suicide. We're finding out that it is very preventable, that there are warning signs, and Alina will get more into this in a few minutes, but a lot of funding has opened up because of that, because we know there is something we can do. Just like with heart disease, we go out and treat about obesity prevention, things like that. Same kind of thing. We can do something. This is preventable. Things that we're trying to increase awareness of are the resources that are available. They say that in communities like ours, where we do have a higher than average suicide rate, sometimes it may be because we are a small community. We don't have as many resources, perhaps, as they do in a larger city. Also, we do have a stigma attached to suicide. We don't like to talk about it, right? It's the S word, just don't say anything. Don't ask, don't tell. But we need to get rid of that, or else our rates are not going to change, at least not for the better anyways. All right, so the data. As you can see up there, U.S. data next to Utah data, 40,000 deaths a year in our country. It's the 10th leading cause of death for all age groups. If you average that out, that's one death every 13 minutes, or about 110 every day. That's too many. That's a lot. And if you look at Utah, we're actually ranked, as of 2013, ranked number 5 in the country for suicide death rate. It's not, in the good way. I wish we were 45th, but we're not. 2012 data, we're always a little bit behind on the data, so this is a little bit old. Sorry about that. That's kind of how it works. 545 deaths in Utah due to suicide. Currently, for all age groups, again, it's the 6th leading cause of death. In our teenage population, it's actually, in Brigham City, it's the 2nd leading cause of death. So in Utah, we're averaging 1 death per day, which, for our attempts, you generally have more attempts than you have actual completions of suicide, right? So we average about 4,000 attempts over, each year in Utah. Also, if you think about those attempts, even previous to that, so you have completed suicide attempts, and then you have ideation, so that's where we're thinking about it. Utah is actually, in 2013, we were number 1 for suicide ideation. Chances are several people in this room have thought about it. So really, we need to make sure that we're taking care and watching out for our friends. Risk windows. So a lot of you probably already know a lot about these things, especially people who work out in the community. Things that increase suicide risk: substance abuse. If you have someone that's been drinking, using substances, their inhibition level is lower, they're more likely to do something drastic. Also, untreated depression. Like I mentioned before, they say that maybe one of the reasons why we have a higher than average suicide rate is because of our lack of resources. A lot of people don't go out and seek the help that they need because they either don't know where to find it or because of that stigma again, right? They don't want to ask for it because they don't want to be broken. Using alcohol and other substances is kind of the same thing, especially if you add depression on that. It's just kind of that lethal triad that we'll actually talk about in a little bit as well. Post-traumatic stress disorder. That's one of the reasons why they say that maybe our crisis workers have a higher than average rate, and our military. Other things that can cause it, of course, overwhelming stress if you have a death of a loved one, divorce, terminal illness. If you just found out that you have cancer, that's a pretty big one. False legal accusations. If you feel like things are not going your way and you might be locked up, but that's kind of one of those crunch times where we don't really know what to do. So things to look out for, risk factors to talk about, and we'll talk about a few more risk factors here in a minute as well. As I mentioned before, studies are showing us positive things. Suicide is very preventable. There is something we can do about it, and it's not just something that a trained professional can make a difference. Anyone can make a difference. We all have our part to play. Whether you take out the garbages or you're an EMT, you have a part to play. You are important, and so are those around you. Also, it's important to remember that suicide thinking and planning doesn't just hurt the person themselves, but it also can hurt others. So it's good to make sure that you're keeping not only someone else safe, but yourself safe as well when you're trying to help someone else. So now I'm going to turn the time over to Alina. She's going to talk to us a little bit more about the Q, P, and R. This is kind of our tagline, ask a question, save a life.
How many of you have heard of QPR? Few of you? Okay. Yeah, so as Amanda mentioned, ask a question, save a life is the tagline, and basically it's about getting the conversation started and keeping that conversation going, providing support in our community. That's really what the basis of what we're here to talk about today. As she mentioned before as well, we're not going to leave here being trained mental health professionals. We're going to leave that to them. They've had many, many years and course study for that. We're going to leave that expertise to them, but we do know that we have an ability to make an impact and to help people in our community as well. So as you see this next slide, so QPR, as you can see on the slide, basically again, our hope is to build a community of gatekeepers, people that are being intently watching for signs and symptoms and are willing to take a step forward and to assist others. So the Q actually stands for question. We'll be asking some questions. We'll be talking and giving you some tips on how to ask some of those questions. Then the persuade actually is again about providing someone in crisis some assistance and some support. Instilling hope really is our basic purpose. And then also you can see with the R, refer, is to refer them to a professional or someone that can actually surround them with more support to get through that immediate crisis. So QPR is not intended to be a form of counseling, okay? So again, it's not that we're going to leave here mental health professionals. It is, again, meant to instill hope, to provide positive action, to give us some tools so that we can take action ourselves. Many times when a suicide happens, people are, well, obviously they're devastated, and it does impact our whole community. There's a ripple effect. And a lot of times people are really caught off guard and they're really puzzled and confused. But then when the family or the people closest to them start to look back, oftentimes they will see they'll realize that there were little subtle signs and symptoms. And so that's what we're going to be talking about today, identifying those subtle signs and symptoms, or maybe some very direct signs as well. And just as Amanda had mentioned earlier, QPR, like CPR, with CPR, we may not be heart specialists or heart surgeons, but it is a time to provide critical life-saving support. And again, that's what QPR is about, providing that measure until someone can step in that is a professional to take over. So we're going to go through first and hit on a couple of myths and facts. And so the first myth that I want to talk about is no one can stop a suicide, it is inevitable. So people in crisis, if they get the help that they need, most of the time that's where it ends. They get the help that they need, they work through that crisis, they work through that situation, and they see that there is hope and that there is a sense of support around them. So another myth is that only experts can prevent suicide, and that is just simply not true. we have the ability within us to actually reach out and also assist those people through those very difficult times. Again, most of the time it does require someone to step in that has had specialized training as well. But it is everybody's business. We all need to work together. We all have that responsibility and can assist as well. So suicidal people keep their plans to themselves. That is also a myth. Oftentimes, as I mentioned earlier, there are little subtle signs that come up that people will identify after the fact. So we're going to be watching for those, and we'll give you some tips here. But just preceding the attempt, oftentimes there becomes this vocal time when they are actually searching and looking for help and support. So it's important that we identify that and that we can address it at that time, that very critical time. Another myth, once a person decides to complete suicide, there's nothing anyone can do to stop them. Again, all of us working together, providing that hope and providing resources and support definitely can work together to save a life. So sometimes the warning signs are very subtle and sometimes they're very blatant. But the important thing for us to remember as individuals of people that we care about, our coworkers, our family members, our friends, our neighbors, is that we need to just be mindful and watchful, and we need to practice listening. So if we see any of these signs, whether it's obvious or subtle and just puts a little question in our mind, that's our cue to act. Okay? So take all signs seriously. So here are some direct verbal cues that we may hear, and you can see they're all very obvious. I wish I were dead. I'm going to end it all. If such and such doesn't happen, I'll kill myself. Those are all very direct cues. Okay? Sometimes they're not always that direct, and you'll see the next slide actually goes through, and some of these are a little more subtle. I won't be around much longer. I just want out. I can't deal with things any longer. That kind of language. If we hear that kind of language, it could be every bit as serious as those direct cues that I just mentioned. So we want to also be mindful of that. Some behavioral warning signs, so some things that we may visibly see as anyone that's had a previous attempt, there is a potential risk there. And then acquiring a means or a way to commit suicide, whether it's acquiring a gun or possibly stockpiling pills. And you can see on this slide I put possibly in parentheses, because we live in a society where a lot of us kind of hoard up our medication. We kind of hold on to it in case we need it down the road, which from the health department standpoint puts all of us at risk, really, especially when we are talking about like narcotics and things like that. If we have a surgery or we have a knee that acts up or something like that, and we keep those pain medications just to kind of have them around, it actually does put not only us as individuals, but our families, our friends, our teens, all of those people at risk. And then if we see maybe grandpa stockpiling his medication, it may be because he's forgetting to take them. That may be a different type of warning sign for us. Or it could be possibly that he is concerned about money issues and stockpiling him for that matter. Or maybe he's got other intentions and he's just tired of being sick and he's tired of being tired and he's looking for a way out. So those are signs, could be subtle signs that we need to be mindful of. Also, any kind of co-occurring other mental health disorders or issues that are in place could put us at risk and be a behavioral sign. And then seeing someone put their personal affairs in order can also be a signal for us to to be more mindful and to be more attentive. As we continue here, you can see that first slide, or that first bullet, I'm sorry, says giving away prized possessions, things that mean a lot to us. We see this sometimes with teens, and not to be disrespectful to our teens, but sometimes just the brain development that they have at that point, they tend to be a little bit more materialistic. So if you see them giving away all of their CDs, or their motorbike, or their dirt bike, or something like that, those things that are very meaningful to them, that could definitely be a cause for alarm. Also, sudden interest or disinterest in religion, a relapse, that's again associated with a lot of fear, a lot of potential shame, and those kinds of things that are very difficult to work through on our own. Any unexplained anger, aggression, irritability, a severe shift in personality traits can be a warning sign for us. So those are all behavioral clues that we can be watchful for. As far as specific situations, You can see again listed being fired or having a sudden shift in our daily norm, being expelled from school, things like that. A sudden loss of freedom, being indicted or arrested or something to that effect can have a profound effect on a family. Recent unwanted move, again, that can be really uproot our normal day-to-day. And then also a loss of a major relationship, regardless if it's a breakup with a teen or a divorce of an adult, or it's a death or a loss of someone that's close to us, especially if a suicide was connected to that. It increases our risk as well. And then, as Amanda mentioned earlier, diagnosis of a serious or terminal illness can also be a very devastating news and can cause that fear and that doubt about the future, those kinds of feelings to surface as well. A couple of other situational warning signs can include that public humiliation, fear of punishment. We talked about that with a possible arrest, or even at school, with young people, with social media and those kinds of things. There's a risk for a lot of damage to be done. It's a great way to connect with people, but it also does put us at risk for this type of shame and humiliation as well. And then also anticipated loss of financial security. Again, that could be a loss of a job. It could even be retirement. Like, retirement is supposed to be a great, wonderful time, but all of a sudden your day-to-day norm shifts. You, again, may not feel as financially stable or secure. And then also you can see we've listed a loss of someone that's close to us. And in this example, it's people that have provided some kind of a support role for us. So if we have that type of loss, that can be definitely very devastating. And that fear of becoming a burden to others, again, thinking about the example of grandma or grandpa and at those end-of-life issues and not wanting to be a burden on children or whatever that is. Losing our independence, things like that can really put us at risk as well. So with suicide, that Q part for QPR and asking the question, I just want to kind of put you at ease a little bit, because I know when I went through this training, and it was actually a whole day-long training for us, we actually got the opportunity, as you will as well, to practice asking some questions, and they can be difficult questions. But what I want to put you at rest about is really when we're working through this QPR, these steps, 90% of this really should be listening. 10% should be providing support, asking questions, linking them to resources. So 90% of it is just being engaged, being genuine, listening, and providing support in that way. Okay? So tips for asking. If in doubt, if we see any of those subtle signs, if we see any obvious signs, don't wait. Ask some questions. Get more information to see just exactly how much of a crisis situation this is. If the person's reluctant, be persistent. Okay? Not everybody is going to be forthcoming and just give you everything that you want. Sometimes you have to get the conversation going, build some trust, build some rapport, so that they feel safe and they can continue to share their very personal thoughts. Allow the person to talk freely. Again, a lot of that just comes down to having a private, respectful setting, and then giving them the opportunity to talk while you listen. And then also having resources handy. You will see up front when you leave today, you're welcome to come up and take some additional resources. You've been given a booklet, but also we have some little wallet cards that have some information that are handy just to keep with us. Stick them in our purse, maybe have one in the glove compartment. We want to have these resources handy. And by the end of our hour, it's really easy for you to even have one quick phone number memorized. And we'll talk more about that here in just a second. But the last bullet, I just want to encourage you to be bold. Again, it's not easy. I've used this one time, to be honest with you, and it was not an easy situation. And it took stepping out of my comfort zone a little bit. But I can tell you that after I did that, after we practice, which we'll be doing here in just a little bit, it does help, and it does make it, it is an empowering feeling to be able to offer that support. Okay, so asking some tough questions. Sometimes people are more comfortable with this less direct approach. So asking, trying to get the ball rolling. And everybody will have to gauge this differently. And I'm sure when you think back in your life, there's times when you could have used these steps. But everyone will have to gauge the situation a little bit, case by case, to see how it's going to come about for you. But just asking simply, have you been unhappy lately? I'm sensing that you're really struggling. trying to engage and open that conversation. I can see that you're unhappy. Have you been thinking about ending your life? That's kind of taking it to the next step. Do you ever wish you could just go to sleep and never wake up? And, you think about like brand new mothers. I think back when I was a brand new mom and how exhausted and tired I was, and I thought I would never ever get a night's sleep again, and how overwhelming that can be. Sometimes it's just having that dialogue and being able to talk that through to someone. If someone's going through a difficult crisis as far as a health condition or something like that, it can be very overwhelming and draining, and as even for the family of someone that's suffering that. So it's important that sometimes we recognize those cues of exhaustion and things like that. So a more direct approach you can see here is just, you look pretty miserable. I'm wondering if you're thinking about suicide. That's pretty direct. Or are you thinking about killing yourself? Okay, like just coming up and asking. Obviously you wouldn't just walk up to someone. It's about developing a sense of trust and relationship so they feel comfortable opening up to you. Because a life may be at stake, if you can't ask the suicide question, it's important that you find someone that can. Okay, so just like with CPR, if we saw someone in a cardiac crisis, we wouldn't just turn our back and go, oh, it's probably not that. We would at least call 911. We would ask someone that could have those skills to step in and assist. So find someone who can, if it's too uncomfortable or you just don't feel confident to ask these questions. So how not to ask the question? If you were to hear this type of tone, you're not thinking of suicide, are you? You wouldn't do anything stupid, would you? What would you think? What would be your automatic first defensive kind of response? You would probably feel like you're being judged, right? And so we don't want to place that at all. It's not about a time of passing judgment. It's about providing support and instilling hope, okay? So we want to make sure that, again, we're asking some pointed questions, but they're questions that are going to be supportive and help draw out a conversation that's going to be helpful and hopeful, okay, and not instill shame or more fear or judgment for sure, okay? So moving on to P. Again, persuade is about persuading the person that they matter, that we care, that others care, and again, instilling that hope. So really the P piece is that connection that you want to make with that person, okay? Again, when I went through this QPR process with the person that I assisted, total stranger. All I had was her first name. I never did learn her last name, okay? So that was really challenging. And was it scary? Yeah, it was kind of scary for me. It was not a comfortable situation. But these steps are very, very simple. Anybody can do them. And it did help to give me a sense of strength to kind of move through and to assist. And so as you look at this slide, listen to the problem. Again, 90% of what we're doing is going to be listening. Give them your full attention. Give them supportive language, like, I want you to live, I'm on your side. What can I do to help? Those kinds of conversations. And remember that suicide is not the problem. It's only the solution to a perceived unsolvable problem, okay? So most of the time with suicide, people do not want to go that way, okay? That's not their intent, but they feel so hopeless and so out of control that they just have come to feeling like that could be an option to escape the pain. So I want to add this little tip. I added it to the slide just recently to make sure to cover it. So at the bottom there, you're going to see that I'm going to suggest not saying, what about your family? Because that would be the first thought, right? When we have a suicide in our community, it's awful, it's devastating. But we also think about, well, how sad for the family. And it is. It's devastating for the family. But by asking someone in crisis, but what about your family? There's two things that we risk. One thing that we risk is, what if their family's part of the problem? What if they're in an abusive situation and they feel like this is the only way out? Okay, so there's that possibility. The other possibility could be that they could interpret that, well, what about your family? That your family's feelings are more important than your feelings. And again, that leads to that, I'm not worth it, I don't deserve, And so we don't want to build that either. We want to, again, make them feel like they're every bit as important in our community as the next person. Okay? So persuade, again, involves offering hope in whatever form that is. It's going to be different in every situation. The situation that I mentioned earlier about my situation, I started to talk to her about trying to identify sources of support for her. And she's like, my kids are grown, they don't care anymore, they're on with their own lives, they've moved away, they don't have any contact. So I could see she didn't have a lot of familial support. She wasn't connected to any kind of religious affiliation. She was really bitter about some things that had gone on where she had been going to church. Finally, the way that I connected with her, I asked her if she had any pets. So we got to talking about our dogs and talking about how excited they are to see us when we get home and how much they rely on us. If we don't come home, who takes care of them? So that was how I ended up bridging that gap and finding some kind of way that I could reach her with, there are people that, well, people, there are others that need you, that care about you, that depend upon you. And so, again, that can be different for anybody, but think about the value of the coaches in our community. Of course, family, friends, siblings, our religious leaders, but even our physicians, our roommates, if we're in a college situation, those kinds of things. Those people play vital roles. And then ask, will you go with me to get help? Will you let me help you get help? Will you let me call someone who can help? So taking those next steps, those are some of those questions that we can ask as well. So moving to R, or refer, suicidal people often feel like there is no help, that no one is going to be available to them. And as Amanda mentioned, the stigma is there that if we ask for help, we're broken or we're weak. And we need to change that. We don't think twice about going to the doctor if we have high blood pressure, right? Does that make us weak? No. We go and we get our prescription and we take care of things, okay? So we need to have the same kind of mentality with our mental health as we do our physical health. If we need assistance, we go ask for help, okay? And we look for treatment. And that's really important that we help to put people at ease and encourage that as well. So in our area, there is more help available than what we even realized. When we first started receiving funding for this project, we're like, you know, yeah, we're not as, we may not have as much as like the Wasatch Front down in Salt Lake City, but we do have resources available. There is help available, and there is hope, and that's what we want to instill. So again, referral, the best referral is taking that person directly to someone for help. It could be another family member, it could be the religious leader, it could be a trained professional. The next best referral is getting a commitment from them that they will accept help, and then maybe helping them make some arrangements. And then the third best, like we just can do what we can do, right? But any little bit of help that we can do can make a difference. But the third best way is to reinforce that they do need to talk to someone, they do need to follow up with someone, and you know, that willingness to take this further and to explore what kind of options they do have to work through this crisis situation. As individuals, we can also continue to offer our support even after that initial step. You know, maybe they do go to their religious leader or they do go to their school counselor. Then we can follow up and we can say, you know, I've been thinking about you lately. How are things going for you? Okay, and just kind of again showing that care and concern, because caring can save a life. With persuade. Again, persuading someone to get help can be difficult sometimes, but again, we need to be persistent. We need to be bold. When we apply QPR, you plant the seeds of hope, and hope does help prevent suicide. So Amanda mentioned this lethal triad. For many of you that work in law enforcement, I'm sure that you have witnessed this. If you see a distraught, depressed, upset, agitated person, and you have substance use of any kind on board, plus a firearm, it automatically escalates everything and takes it up, dials it up a notch, so to speak. So even in a domestic situation where we have people in a home that love each other, if those three things are in place at the same time, there is a potential risk for further harm, either to self or to others. So by removing one of those pieces of the triangle, diffusing the situation, bringing the person's mental state down to a stable situation, removing the firearm, whatever it is, then that's another way that we can step in and assist in preventing a suicide. So let's talk a little bit about means. Means is the way that a suicide is carried out, basically, okay? So something that we need to be aware of is suicidal crises are often brief, and many times attempts, even though maybe somebody has thought about it and they've had that ideation and they've thought about it a little bit, oftentimes with a suicide attempt, it's pretty quick. There was a final straw that broke the camel's back, and I just can't take it anymore. Okay, can come down to a really critical, fast kind of stage, and so that's where these critical steps are really important to get them in place. In our state, we have about 54% of our suicides are due to firearms, 22% suffocation, and 19 to 20% poisoning. So you can see, as far as our state goes, the majority of our suicides are due to firearms. So sometimes the method of suicide obviously is more deadly. Like taking medication versus a firearm, you can see there's kind of a drastic difference. Both can do the same, have the same outcome, but at the same time, you can see one is potentially more lethal than the other. So that's why we're talking about means. And so again, for firearms, the leading method of suicide in the U.S. and also in Utah, and some of you have guns on in the room, so keep them holstered, please, as I go through this information. But gun owners and their families have a 3 times higher risk of suicide than non-gun owners. That's not to say that there's more mental illness with gun owners. That's not to say that they're more, that they think about suicide more, or that they even attempt suicide more. But a gun owner has a more access to more lethal means, is what that means, okay? So rather, they simply are more likely to die from a suicide attempt if that's the method that they choose, okay? So a simple step to increase safety for others as well as a suicidal person is to reduce those lethal means. So it could be just a temporary, we don't have guns in our home for right now until we can work through this crisis. Or it may be medications. Again, as far as the health department standpoint, we encourage people to clean out their medicine cabinets. We don't need a lot of unused, expired, old medications. We need to get them out of the house so that we're not at risk for theft, we're not at risk for accidental overdose or intentional overdose. We want to be mindful of what we have. If we do have some of those things in our home, we need to have them locked up and secured. We don't want our kids getting into them. We don't want our kids' friends getting into them. We don't want that situation. So reducing lethal means. And oftentimes family members of someone that's going through a difficult period, a crisis period, they may not think of this. So as a QPR gatekeeper, that could be a suggestion that we might make. Okay? Again, this is not an anti-gun statement. This is just a temporary intervention to help reduce that lethal triad situation or to reduce access to lethal means. So again, it could be stepping up and storing firearms for someone else, or identifying that we need to not store them at our home for now, or removing, locking them up, removing a key component so guns are disabled. Again, locking up medications, as I mentioned, cleaning out, and getting rid of those things that are around our home that could be putting us at risk. So now we're going to move into a little section, and Amanda is going to assist with facilitating a practice so that we actually can say some of these questions out loud, ask some of these questions out loud. Again, when I was talking about the situation, my personal situation, as I was talking to her, I'm like, I know I got to ask this question, I know I got to ask this question. It was difficult to get it past my lips. But practicing it does help, and it does reduce that fear in us so that we are more empowered to help. So Amanda's going to give you some example, and she's going to give you some instruction on how we're going to do that.
Perfect, thank you. So I'm going to give you some guidelines, and then we're going to go to the next slide, which is actually the scenario that we're going to use. So everyone needs to find a partner. I know you guys love to role play. It's going to be awesome. I love it too. But really, like Alina said, if you have some sort of, even if it's a funny experience, it's something that you can draw upon if you do get in this situation where you have to apply this. So you need to have some sort of way to help you remember. So everyone needs a partner, and you need to decide who's going to be the person in crisis and who's going to be the friend, the gatekeeper, the person prepared to help. Okay, does everyone have their friend and their partner? Decision time. Okay, so everyone get their partner. Here's the scenario. I'm going to read it to you. Your coworker Bob, so Bob is the person in crisis, okay? Your coworker Bob has not been himself. For the past several months, he's been moody and unreliable. Last week, he was reprimanded because he's missed so much work. This made him even more irritable and depressed. Bob seems less engaged and almost avoiding interaction. He vaguely mentioned that he has been having some difficulty with his family and seems very anxious. You finally get a chance to grab lunch with him, but he seems especially quiet, then mentions he's a pretty worthless friend and that you'd probably be better off without him. Okay, so everyone decide who Bob is, decide who the gatekeeper, the friend is, and go forth. Yes, work through the steps. Your booklet has the steps in them. There's also an app that we can help you find if you'd like it to have on hand, so you don't have to carry your booklet with you into the real world. But if you have any questions, we'll be kind of wandering, so please feel free to ask us or tell us funny stories. Did you have? Okay.
For those that are watching the video, please read through the scenario and at least practice it in your mind, or take the opportunity to take it to a friend or a coworker and also try to process this the best that you can.
So we've had some very good conversations going on. Thank you so much for participating in the role play. A couple of things that we wanted to bring to your attention. First one, it's really important to make sure that you are kind of following your gut. If there's a way that you know that the other person will respond to you, if you're already friends, you know that, okay, maybe I shouldn't just jump the gun and say, hey, are you thinking about suicide? Just walking up to them. Make sure that you are developing that. Okay, I am your friend, I love you, or I don't know you, but I still care about you, before maybe you kind of go for the jugular there. Also, I know, right? No pun there. Also, I think it is also important to make sure that that you're doing it in a way that is genuine. Right, so that's why there are so many different options for ways that you can bring up the question. I think especially for those people who know us, you know, talking about the suicide question may make you feel uncomfortable. It probably does for most of us, and that's okay. If they're your friend, they know that. Seeing genuine emotion and concern and even anxiety on your part could be kind of a stability, like getting them more stable, I guess, if that makes any sense. But really, it's familiar for them. They know you, they love you. Seeing you vulnerable could help them. So try not to be fake in this. Make sure that you're being real.
Just be honest. Say, I'm really uncomfortable with this. I'm kind of over my head here, but I'm really concerned about you, and I really want to help resolve this, and I want to get you the support that you need. Be honest about it. It's totally natural for you to be uncomfortable. We're not trained to do this on a daily basis, so trust your gut and be genuine, and that's really what you're gonna provide the most help and hope.
Perfect. Thank you. Oh, yes. Well, we're going to move to the next. So, resources. The first one we have there, the National Suicide Prevention Lifeline. We also have the little cards that Alina mentioned that do have that lifeline on them as well. Kind of a good number to just program into your phone in case you ever need it, so that you're not like, crap, I know that there's a lifeline, I don't remember what it was. It's good to have that on hand. We also have Spanish cards available if you do have friends, family members, or even if yourself, if Spanish is your primary language, it's great. They also have that resource available. Suicide Prevention Resource Center is a great resource as well. We recommend going onto their website. Also on the Bear River Health Department's website, we have a resource guide specifically for Box Elder County on the little QPR cards that you got on the back. There, at the back of the booklet, there's a label that says the website and has a QR code that you can scan with your phone. Also, in that booklet, which I forgot to mention on Tuesday, but there is a little tear-out card, a little wallet card that you can fold up, have in your wallet to take with you. Also, another thing that I kind of mentioned a little bit earlier was that there is a QPR app for phones. I have an Android. I don't have an iPhone, so I know that they have them on iPhones too, but if you search, the name of the app is Suicide Crisis Support. They also have the National Suicide Prevention Lifeline on their app. You just push a button and it will call it for you. Yeah, it's 24/7, 365. Thing to remember about the National Suicide Prevention Lifeline is, of course, it is there for people in a crisis situation to call, but it is also created for those of us, the gatekeepers, the friends, the family members out there who are concerned about someone, to call and get support and reassurance on how to proceed. So if you're worried about someone, you can call this number and they can help you know what to do. Perfect. All right, so to conclude, remember our tagline, ask a question, save a life. Really, this is a life-saving technique. We've seen it in our own lives, and we really encourage you to keep this in mind if you do have friends, family members you're concerned about. As Alina mentioned before, and I just remembered to mention this again, really, just because somebody, makes a change in their lives doesn't mean that they are going to attempt a suicide. But it should be, we need to watch out for those flags. It's never bad or wrong to ask the question. Studies show that asking, are you considering suicide, does not increase the likelihood for someone attempting. So, just think about how you would feel if you made a whole bunch of changes and someone came up to you and said, wait, are you, it's okay. And it just shows that they care. So make sure that you are doing that, because you really can make a difference. So take a minute, flip over that evaluation form. Please fill out the back for us. As Alina mentioned before, it really does help us out to have those filled out. We are able to do this for free for you guys because we have funding and our funders like to see that we're actually doing our job. So please fill those out. Also, if you're watching the video, please pause and fill out that as well. What? Post QPR evaluation.